someone on TikTok did this video where there's this like AI chat, and they asked them questions about prison, and then they were answering the questions that the AI was asking about prison. So I decided to do it, since I've obviously never been to jail. I decided to do it about psychiatric hospitals and schizophrenia and see what it reacts. I don't know how the quality is going to be, because even though the iPad's newer than my phone, I don't think it has the best camera quality, but we're going to give it a try. To be fair, I just downloaded the app. I thought it was called Chat GPT, but then when I Googled in the App Store, it popped out as AI Smith. So this is what the app looks like. Ask app not to track. And so, I've never used one of these before. No. I don't want all S. I don't want... Oh, X. Okay. There we go. It says select your primary need. AI assistance. Input your... Open chat. Hold on. Ready-made prompts for each AI assistant. Oh, input your own prompts. Okay, that's what I want. Okay, so, of course, there's an ad. Any day now. Sometimes these ads get to you because I won't put an X on. Oh, close. Okay. So, I have 5 free messages left, so I gotta be careful. So, let's ask, what do people want to... Okay. Let's see what it says. Oh, okay, it gave me, like, a bunch of questions. Okay, so let's answer these. Alright, first one. This is all the questions it gave me. I was surprised. I thought it would just give me one-ended question. What is a mental hospital, and how is it different from other healthcare facilities? Well, I feel like this is kind of, not idiotic wouldn't be the word, but kind of not basic. That's the word. Okay, so it is different from other healthcare facilities because it treats behavior. So there's like, it's not like an, I don't even know how to explain this. Lori, are you listening? Anyway, okay, so I'm going to try to answer these questions as serious as possible. How is it different from other healthcare facilities? Okay, a lot is similar. They have like nurses, they have doctors, they have technicians, which they also have at regular hospitals, but a lot of it is different on the fact that you are interacting with other patients. On another healthcare center, you might be more confined to your room. There's groups, and they want to get inside your brain. So it's very similar to like what I call the normal people hospital, where it's like very like, what's the word? Hospital? Lori, what's wrong? Are you mad at me?
No.
Okay, alright.
Sometimes I just zone out.
You're not mad at me talking about this, are you?
No, not at all.
Okay.
Do your thing.
So, did they say what is a mental hospital? So it's for psychiatric conditions. So, anything that's psychiatric, like if you're, a lot of people there for suicide attempts or stuff like that. What are the typical conditions and disorders treated in a mental hospital? So this is actually interesting because as a teenager, I saw a lot of like depression and anxiety. As an adult, I see more schizophrenia, schizoaffective in mental hospitals, but that might be the units down because they have like different units. Like at the last hospital, Riverwoods, I was at, they had the acute unit, which I was on, and I live in the Atlanta, Georgia, by the way, and then they had the so they had the acute unit, which was severe, and then they had a unit called Progress, and they had a unit for kids, geriatrics, and then a military unit. Okay. What are the typical conditions, disorders treated in a mental hospital? I guess I just answered that. Okay. How long do people stay in a mental hospital, and what is the typical treatment plan? So people usually stay at short term for an average to 1 to 2 weeks, or 5 to 10 days. 5 to 10 days. Typical treatment plans, you go to groups, you get medications, you get therapy, stuff like that. Who is eligible to retreat in a mental hospital, and do they need to be committed? So anyone that is dangerous to themselves or others or cannot take care of themselves physically can be 1013, which is what it's here called in Georgia. And the Wi-Fi, the lights just flickered. And yes, they do have to be committed, but you can go voluntarily. But just because you go voluntarily doesn't mean that you're going to be You can leave whenever you want, which that's a whole nother video. What are the admission procedures and requirements for mental hospitals? So this is actually interesting. So the admission either starts when you're 10, 13. So when you're 10, 13 to a psychiatric hospital, which is a 72 involuntary hold, it means that you go, either a therapist can do it, or LCSW can do it, LMFT, LCSW, which these are therapy things. Requirements are you have to be a danger to yourself or others, and the admission procedures, either you go to the hospital, because some hospitals like Summit Ridge, which is a hospital here in Atlanta, you can go to and you can be admitted there in the admissions office. Some of them, they'll tell you to go to the ER, and once you go to the ER, then you're taken to a facility, and usually they place you within 24 to 48 hours. Requirements is, obviously, if you're severely intellectually disabled, you can't go to, like, I don't want to say normal because that sounds mean, but, like, sorry. If you're, like, severely intellectually disabled and you can't take care of yourself, meaning you can't bathe yourself, you can't perform ADLs, which are, like, basic living skills, then you can't go to, like, a normal mental hospital, I guess. What is the level of care and support provided in a mental hospital, and how is it different from outpatient care? So the level of support is more intense because they have to check on you every 15 minutes minimum, and some people on 10-minute checks, some people on line of sight, some people on 1-to-1. It's different from outpatient because you're constantly getting treatment. It's 24 hours a day. What are the safety measures and protocols in place in mental hospital to prevent harm to patients? Okay, so this would be like a no-brainer, but nothing that you can harm yourself with. And they get creative. No shoestrings, no hoodie strings, no razor blades, no makeup with mirrors in it, no cell phones, no laptops, no iPads, nothing like that. And they check on you every 15 minutes. So yeah. How are mental hospitals staffed and trained to deal with psychiatric emergencies and challenging patient behaviors? Well, I wouldn't really say they're trained because a lot of them do the crappy job, but honestly, the only thing that they do is keep people safe. If I'm suicidal or I'm having a psychotic episode, the thing that keeps me safe is, they keep me safe because like, to the previous questions, they have a lot of safety measures to prevent harm. So they obviously don't have knives and stuff like that. How do mental hospitals integrate family and community support in their treatment approach? Well, again, they don't do a very good job, but they're supposed to, Lori, you're talking. It might pick up on the video. I mean, I'm not going to okay. I'm just letting you know. I can't hear it, but it might pick up. I'm going to refilm this.